Hello and thank you for joining. My name is Lindsay and today I will be doing a presentation on bladder cancer for a community health project for my community health nursing class at Indiana State University. If you could please take a moment to stop here and complete the pretest that is attached in the YouTube link to determine your current knowledge on bladder cancer. So the bladder, usually known as the urinary bladder, is a balloon-shaped organ in your lower abdomen. It stores the urine that passes from the kidneys via the ureters until it is passed out of the body through the urethra. Bladder cancer involves malignancy of the cells in the bladder and surrounding tissues, such as the kidneys, the ureters, and the urethra. And according to the CDC, each year in the United States, about 56,000 men and 17,500 women get bladder cancer. Now, there's obviously more than one risk to develop cancer, but our population at highest risk is going to be smokers. Others at risk are going to be those with a family history of bladder cancer, those with certain gene mutations, being exposed to large amounts of certain chemicals found in the workplace, and these include things such as paint, dyes, metals, and petroleum products. Some chemotherapy drugs such as Cytoxan and cyclophosphamide, as well as having chemotherapy in general, all can increase your risk of developing bladder cancer after therapy. Other risk factors include arsenic-contaminated well water, the Chinese herb Arstolochia fengqi, and then having a history of chronic urinary tract infections. Signs and symptoms of bladder cancer can imitate signs and symptoms of other conditions, so getting them checked out, even if you think they are minor, is important. Signs and symptoms include blood in the urine, also known as hematuria. This is the most common symptom. Urinate frequency, so feeling like you have to go all the time, pain while urinating, known as dysuria, back pain, and pelvic pain. Now, if your primary care provider feels that you may be at risk for bladder cancer or another urinary issue, they will likely refer you to a urologist. That urologist is then going to run some diagnostic testing. They usually start with a basic urine test to gauge how much blood or infection is in your urine. Then up is going to be a cytoscopy. This is where they go into the bladder via the urethra with a scope to see if they can visualize tumors or other abnormalities in the bladder. Urine taken either from that initial sample or from the bladder during the cytoscopy will be sent to the lab to run cytology or to determine if there is any sort of cancer or abnormal cells in the urine. Other diagnostic testing includes imaging such as CT, MRI, or a PET scan. And then there are different tests out there that can test genetics or do a genetic analysis to see if you are at risk for bladder cancer and what type of bladder cancer you are most at risk for. Treatment for bladder cancer generally involves surgery. The most common type of surgery for bladder cancer is a transurethral resection of a bladder tumor, or a TURBT. This is done in the OR. It's a very quick procedure. It takes about 30 to 45 minutes. It is done under anesthesia. Essentially, your urologist will go in and scrape out and cauterize where all of the tumors are located. Those tumors are then sent off for pathology to determine grade and severity of bladder cancer. Most bladder cancer is non-invasive, so the TURBT is done, and then you have repeat cystoscopies done in the clinic every 3 months to make sure that the tumors have not reoccurred. Now, in the event that your bladder cancer is invasive, a little more serious surgery is completed, such as a cystectomy, which basically all or part of the bladder is removed. So a partial cystectomy would be removing part of the bladder, the area with cancer. A radical cystectomy would be removal of the entire bladder. And then other surgeries would include reconstructive procedures for the bladder after removal. Immunotherapy, which is based on invasive or non-invasive surgeries. Types of cancer, not types of surgeries. For non-invasive cancer, the immunotherapy used is BCG, and that is instilled into the bladder once a week for 3 to 6 weeks following the removal of the tumor. It is instilled via catheter, and the patient then leaves that fluid in the bladder for 2 hours before urinating it out. And then for invasive, it is similar in process, but they use medication known as gemcitabine and docetaxel. One of them is instilled into the bladder via Foley catheter, and the patient is rotated every 15 minutes to front, back, side, and side. Then that is drained, the second medication goes in, and the catheter is removed, and that medication stays in for 2 hours, and then the patient is able to urinate. Other options, of course, if it's invasive surgery and they do not want to go for surgery, there is the radiation option that would be completed by radiation oncology. Now, as many know, there is no way to fully stop cancer from developing. There is no set prevention, but with bladder cancer, the biggest one is going to be not smoking. So if you are a current smoker, stop smoking, and if you are not a smoker, don't start. Other preventions are going to include limiting exposure to workplace chemicals. Again, those include things such as paints, dyes, metals, and petroleum products. You're going to want to remain adequately hydrated. There is research that shows that keeping the bladder hydrated and the body out of dehydration can decrease the risk of bladder cancer. And then, as with any sort of medical ailment, you're going to want to keep a healthy diet, lots of fruits and vegetables, maintaining a healthy weight, and avoiding those bad things for the body. So we've reached our reference page here. I want to thank you for joining my brief presentation on bladder cancer. And of course, if you have questions, reach out to your primary care provider, or you can reach any of these websites I've used here for references, such as cancer.gov, the cdc.gov for bladder cancer, and Live Science. All great resources for learning more about bladder cancer. If I could ask that you please take a moment to complete the post-test to see the kind of information that you have learned regarding bladder cancer, it would be appreciated, and thank you for your view.